Hey, and welcome back to another anatomy video. In this video, I'm going to be going over the eye model, and so we'll be looking at the different structures that comprise the eye. Following the video, I'm going to actually have a spot at the end where you can just test yourself on the material that I just went over. And so the way that that's going to work is I'm going to throw images up on the screen, ask a specific question while pointing to a structure. You can pause the video at home and then go ahead and answer the question, and then I'll just throw the answer right up on the screen for you. So, if you feel like you already understand this model well enough and you really just want to test yourself before the exam, feel free to just skip ahead. But obviously, if you want a little lesson on this, I'll be doing that right now. So that's pretty much it. The model is really not that difficult. I'm sure you'll do just fine, but let's just go ahead and jump right on into it. Okay, so here's the eye. The first structure that we're going to be looking at is actually just going to be the lacrimal gland, and that's going to be right here. This is where your tears are actually being produced. The lacrimal gland sits lateral, so it's going to be closer to the side of the body, and so that would tell us actually if we're looking at this eye that we are currently looking at a right eye. And so you have the lateral side over here, and this is going to be the lacrimal gland again that produces the tears. Okay, the next thing that I'm going to be talking about are the muscles of the eye. Different professors teach this a little bit differently, depending on whether or not you need to know the individual muscles or just the fact that these are muscles of the eye. So I'm going to go into them specifically, though, just to cover all the bases here. The very top one up here is going to be known as the superior rectus muscle, and so below is going to be the inferior rectus. Again, we're looking at this from a posterior view, so this is actually the back of the eye right here. And so this right here would be lateral. So this would be your lateral rectus and medial rectus muscles. You would also have your inferior oblique muscle down here. And then this would be actually the ligament of the superior oblique muscle. The oblique muscle would come in here, but this would be the ligament to it. But for all intents and purposes, you could just say that this is the superior oblique muscle right here. Okay, so this is going to be the eye with the top part taken off. I just want to show you this real quick before I show you the next image, just to show you how everything kind of fits together. So I've taken it apart in this image to better explain what's happening here. So the next structure that we're going to be looking at is actually going to be the cornea. Now what the cornea is, it's a sheet of connective tissue that runs over top of the iris, which is the colored part of the eye. This eye has a brown iris, so it's a little bit difficult to see. But the cornea is going to lay on top of that. It's an avascular layer of connective tissue, so there's no blood supply to it. And it's actually in charge of beginning to refract light and get it into the eye, as well as protect the iris itself. At the very center of the iris, it's kind of difficult to see here, but there's actually a hole, and that's going to be your pupil. So your pupil is actually the absence of a structure as opposed to a structure in and of itself. And that's where the light's actually going to be traveling through to get into the interior of the eye. This over here is going to be the lens, and the lens would sit inside of this structure. So I'll go back real quick. This is the lens in context to the rest of the eye. The lens is in charge of actually refracting light, so we're able to see near and far distances. Again, the cornea began that refraction process, but the lens is the main player in us being able to see near and far distances. It's able to change shape to bend light accordingly, depending on whether or not an object is near or far, so that our photoreceptors in the back here can pick up what's happening. The way that this lens actually changes shape is it is attached to structures known as suspensory ligaments, which we can't see here on your models in your labs. It's actually going to be there's these white eyelash looking structures, which I'll show you in a few minutes. And those are the suspensory ligaments, and they attach the lens to the ciliary processes, which is this black structure, which is then attached to the ciliary muscle. The ciliary muscle and the ciliary processes comprise what we call the ciliary body. So the ciliary body is actually two structures together, the ciliary muscle right here and the ciliary processes right here. Again, the ciliary processes are then connected to those suspensory ligaments. So when the ciliary muscle contracts, it pulls on the ciliary processes, which then pull on the suspensory ligaments, which are attached to the lens. So you can hopefully get an understanding at this point that by contracting all this, you're able to change the shape of this lens, thereby changing how the light's refracted. So we're able to see either near or far. There are two different cavities to the eye, and the first one is going to be the anterior cavity. And that's from the lens forward all the way to the cornea. And this anterior cavity is filled with a substance known as aqueous humor. If you've done the eye dissection yet, you'll probably recall that when you cut through that cornea, which was a pretty tough structure to actually get through, you had a like a watery fluid that kind of came out of the eye, and that would be the aqueous humor that again exists inside of this anterior cavity. From the lens backwards, we would actually have a cavity known as the posterior cavity. And the posterior cavity is filled with a substance known as vitreous humor. And what vitreous humor is it's a gel-like substance that actually gives shape to the eye. So again, if you recall, if you did the eye dissection, you'll probably remember that when you cut it open, you already had this gel ball that you were essentially able to get out of the posterior cavity. And when you took that out, the eye didn't stay up anymore. It just kind of flapped down like a sack. And that's because it didn't have that vitreous humor, that gel-like substance in it anymore. So just to reiterate, lens forward is known as the anterior cavity filled with aqueous humor. Lens backwards is the posterior cavity filled with vitreous humor. So going back to talk just one more time about the ciliary body and the suspensory ligaments, because the last image had everything kind of covering it up. This was the ciliary muscle. These are the ciliary processes. Together, they comprise the ciliary body. And then, unfortunately, on this image, I don't have them, so I'm going to try to edit them into this video right now. But you would have these white lines on this model, which would be representing the suspensory ligaments for your lab exam. So we have this muscle right here, the ciliary muscle. We also find actually two other important muscles that are associated with the iris, which I didn't talk about when I was bringing up the iris earlier. This is going to be the posterior part of the iris. So if you imagine if you could flip this structure over, you would actually see the colored part of our eye. This would obviously be the pupil then. And what you'll see in your lab is on this posterior side of the iris, lines that go out like this, and then some lines that go in a circular manner. And what that's meant to represent is the fact that there are two different types of muscles in the iris. You have radial muscles, which radiate out, so they would be the ones that look like this, and circular muscles, which look like this. And what those are in charge of doing is changing the size of the pupil itself. This structure right here, depending on how much light we want to let in. So when there's not a lot of light available, the pupil will actually open up pretty substantially in order to capture any light that it possibly can. Whereas when it's too bright, the pupil is actually going to get smaller. And the way that this works is by radial and circular muscles working together. So you can imagine that when the circular muscles contract, they close in and make the pupil smaller, whereas when the radial muscles contract, they would actually pull on the pupil itself and open it up. So radial muscles allow the pupil to dilate, whereas circular muscles allow the pupil to constrict. The final structures that we're going to talk about of the eye are the different layers that comprise it, as well as the optic disc and the optic nerve. So let's just jump right into that. On the very outside of the eye, you have this white layer known as the sclera, and that's what actually gives you the white part of your eye that we're all able to see. And this is going to be the sclera. It's a dense layer of connective tissue. Just inside of that is a layer known as the choroid, this dark layer right here. And then inside of that is this orange layer known as the retina, which is where all of our photoreceptors are. I'm going to real quick just explain the function of the choroid. The choroid is used because if you know anything about light, it's the fact that any object that's white is white because it reflects all light. Any object that is black or darker in pigment is darker because it absorbs more of the colors of the light. And so you could imagine that if you didn't have this choroid right here and you only had your sclera, right, on the outside, when light would enter in, it wouldn't be being absorbed by this dark layer, and instead it would hit the sclera, and it would just start bouncing around inside the eye, almost like a mirror, and you wouldn't be able to actually pick up any of the light properly. Your photoreceptors have a really tough time because that light would just be bouncing all over. So by having a layer essentially that is able to absorb that light, it just kind of traps the light and allows the retina to do its job. It's a simplified view of it all, but that's pretty much what's happening with that choroid. The retina, though, is going to be again filled with photoreceptors. There are two different types of photoreceptors which you'll need to distinguish between, and those are rods and cones. And what cones are they allow for us to pick up colors, whereas rods allow for us to see in dim light, and so they pick up like the whites and the blacks and the grays. And so that's the difference there. On the retina, there is an area here known as the macula lutea, and the macula lutea is where we start to focus the light. That's kind of the goal of the lens, to get the light back to this area. At the very center of the macula lutea, and I'm actually going to zoom in on it here, is an area known as the fovea centralis or the central fovea. There's two different terms for that. They both mean the same thing. And it's essentially, you could think of it as the bullseye of this macula lutea. And that is actually going to be the highest point of visual acuity. And so when you're focusing on something, the light is being directed at the central fovea, again also referred to as the fovea centralis. And there are actually no rods here whatsoever. It's only cones, so it's only picking up color. But that's going to be what the central fovea is. So we also see right next to that area, next to the macula lutea and the fovea centralis in the middle, we see this area right here known as the optic disc. And although we can't see it on this model, I want you to know that the optic nerve actually runs into here and carries the information away towards the brain for processing. And this spot is actually known as the blind spot. And the reason that they refer to the optic disc as the blind spot is because, again, any light that's coming in, it's being picked up by the photoreceptors on this orange retina layer here. But we can see here that there is actually a hole here in the retina, okay, where the optic nerve is coming in. So you could imagine that if light actually hit this spot, there's just simply no nerves to pick it up. So it is called the blind spot because when light hits at that angle, we don't see that image or whatever it is that's coming at us, because there's just no nerves essentially to pick it up, or no photoreceptors, I should say, to pick it up. So I'll actually show you real quick here another image of that. This is the back of the eye, and this would be, again, that optic disc. You can see that there's clearly nothing here. The optic nerve would come in, but again, that optic nerve wouldn't have photoreceptors on it. Its job is just to carry away information from the photoreceptors on this layer right here. So that's what we have going on with all that. So that completes the lesson portion of this video. The next thing that I'm going to be doing is going into the test portion. And so again, how that's going to work, I'm going to throw an image up on the screen, ask a question and point to a structure, and then if you want to go ahead and pause the video and answer the question, and then following that I will go ahead and throw the answer up on the screen. Again, I would recommend that you not only say the answer, but that you also write it down, because you will need to know how to spell these terms for the exam. So let's go ahead and jump right on into that right now. Okay, please name this structure. It's in charge of producing your tears. Okay, that's going to be the lacrimal gland. Okay, before I start this, I want you to remember that we're looking at the eye from a posterior view, so keep that in mind when you're naming these muscles. If you can name this muscle up here. Okay, that's going to be the superior rectus muscle, and name this muscle down here. Okay, that's going to be the inferior rectus muscle. You can name this muscle right here. Okay, that's going to be the lateral rectus muscle, and name this muscle right here. Okay, that's going to be the medial rectus muscle, and name this muscle right here. Okay, that's going to be the inferior oblique muscle, and name this muscle right here. Specifically, this is the tendon to the muscle, but we're just going to call it the muscle for the sake of keeping things easy. Okay, that's the superior oblique muscle. Next, if you can name this connective tissue layer covering the eye, it's avascular and begins the process of refracting light. Okay, that's going to be known as the cornea. If you can name the colored layer of the eye, on this eye it's brown, so it's a little bit difficult to see, but the colored layer of the eye. Okay, that's going to be the iris. On the model that you're going to have in your exam, there are going to be on the back side of the iris lines that radiate out this way and lines that go in a circular motion. What are the lines that go this way called? Okay, those are called radial muscles, and radial muscles allow for constriction or dilation of the pupil. They allow for dilation of the pupil. And so what would these muscles be called? Okay, these would be the circular muscles, and circular muscles allow for constriction or dilation of the pupil. They allow for constriction of the pupil. Okay, so what would this hole then here be called? Again, it's the absence of a structure. We just talked about it in the last image. Okay, that would be the pupil. Go ahead and name this structure right here. Its main job is to refract the light. Okay, that's going to be known as the lens. Name this structure and this structure. Those are known as ciliary muscles. What would this black layer be? Those would be the ciliary processes. Together, the ciliary muscle and the ciliary processes make up the what? Together they make up the ciliary body. The ciliary body then is attached to the lens via what structures? You can't see them on here. They would be the white marks on the black ciliary body on the model that you guys would be using. Those would be known as suspensory ligaments. From the lens forward to the cornea is a part of the eye known as what? That's known as the anterior cavity, and that is going to be filled with what type of fluid? That's going to be filled with a substance known as aqueous humor. From the lens back is known as what region of the eye? Okay, that's known as the posterior cavity, and the posterior cavity is going to be filled with what substance? The posterior cavity is going to be filled with a substance known as vitreous humor. Name this outer white layer of the eye. That's known as the sclera. Name this middle layer of the eye, this darker pigmented layer. That's known as the choroid. What is the function of the choroid? The function of the choroid is to absorb light that's coming in so it doesn't start bouncing all around the eye. Again, if we just had this white sclera layer, white reflects all light, so if the light came in, it would just start bouncing around, and the photoreceptors would have a very difficult time picking up the light. Name this orange layer in here. That's known as the retina. The retina is made up of photoreceptors. There are two different categories of photoreceptors. Please name both of those categories and give me a brief description of what kind of things each one is picking up. So again, the two types of photoreceptors that we have are rods and cones. Rods are going to be used to pick up dim light, so your blacks, your whites, and your grays. They would help you see at night, whereas the cones are going to be in charge of picking up colors. Name this whole area right here. Okay, that's known as the macula lutea. If you were to have a bullseye right in the middle of it, what would that area be? Okay, that's known as the central fovea, or the fovea centralis. It is the highest point of visual acuity in the eye, and it only has cones in this region. There are no rods. What is this region called? Right here, and what's another name for it? Okay, this is known as the optic disc, and another name for it is going to be the blind spot. What comes in at the optic disc? Okay, the optic nerve would come in right here, and it's in charge of carrying information from these photoreceptors away and out to the brain. So there you have it. That's going to be the eye. I hope that you did really well on the testing portion. If you still struggled with it, feel free to go back as many times as you need to and just review the material again. With that being said, though, if you did do well and you want to check out some other videos that I have posted, feel free to do so as well. Best of luck on your exams, and hopefully I'll see you soon in another anatomy video.